why somebody should look at this, it's thinking about the employee, the impact on the employee. What is it going to do for them? Of course, you as a business, the savings, fantastic. You always want to make sure that you're taking care of your company because you've got to stick around. You've got to keep going. But it's the impact on the employee. It's keeping all those people employed and making sure their families are taken care of.
Welcome to the InPowered Life Podcast, a space dedicated to spreading the message that you have the power within to create everything you seek.
So if you're ready to enroll in a new kind of higher learning, the kind that leads to true personal freedom, then hang here with us.
We're your hosts, Rudi and Rudi Riekstins, and this is the InPowered Life. Welcome to the InPowered Life Podcast. My name is Rudi Riekstins. I'm your host, and today we're speaking with Tim Thomas. He is a results business leader who has over 25 years experience in sales, operations, strategic growth, and is the founder and chief operating officer of an organization called Biz 360. I've brought him on strategically for this episode today because I serve so many people that are in business that are impacting the lives of the people that work inside of the organizations. And so often the work that I do is how do we set you up as a leader so that you can pour into your people the best? How can you have the best mindset strategies? How can you help your employees de-stress? Or how can you give them an overall better working environment? But what we so often negate are what are some of the things that you can give your employees that are tangible, tactical things that they can walk away with that improves the overall quality of their life, not only when they're at work and at their office, but when they go home. They go home to their families, to their lives, and in some instances, even to their problems. So I'm really excited to dive into this conversation. Tim, I want to say thank you so much and welcome for joining us at the InPowered Life Podcast.
I'm excited to be here, Rudi. Thank you.
Man, I am fascinated by you. I'm fascinated by your business. I've obviously had the privilege of getting to know you and some of your team over the past few months and seeing what you do. And so the invitation to have you guys come out onto the show just seemed like such a natural step for me based on how many of my people are business leaders, have employees that are inside of their organizations. I want to get to who are you and how have you built and supported your team and your business and grown it and what you offer. But I want to hook my audience right up front in what are we really talking about today so that they stick around for today's episode and how it can create a great impact in the lives of their business. Because I'm going to butcher this and I want you to clarify this for me. But if you're listening to this as the audience and you have a company and you have more than 10 employees and you're paying your employees and you have benefits with your employees, there is a potential for you to get a phenomenal amount of money back in tax credits if you meet a certain level of requirements. And most companies, they don't meet these, so they don't get the tax benefits. Why I'm speaking to you is I actually have a number of businesses that I'm supporting that do business with you. And they're getting back, some companies $100,000, some are $50,000, and these are in tax credits for additional benefits to their employees. And it costs the employee no money and the employer no money, and you guys seem to do the work. So I would love for you to give that to us again in just a deeper level of context as what does somebody have to gain by doing business with your organization, Biz 360?
Well, that's a really great question, Rudi. And one of the biggest challenges that companies are facing today is that they bear the vast majority of the cost of healthcare for their employees. Roughly about 60% of healthcare is paid for through employers. And so the challenge that a lot of employers are running into is how do we continue to support our employees while inflation is going up, prices are going up, and they're getting squeezed. At the same time, you also have rising healthcare costs in hospitals. Hospitals are operating on margins around 3%, 2 to 3%. And we don't see in the foreseeable future any change in that. And they're also getting squeezed on Medicare, roughly around $130 million in underpayments on Medicare. And so we're seeing hospitals laying off employees. So we have a huge challenge right now. And in America, if we don't figure out how we can meet this challenge right now and innovate, all of us are going to experience the hurt. And in a lot of ways, a lot of us already are. And so what we do at BizPower 360 is we have looked for an innovative way to bring technology and benefits together in a way that also is tax efficient. So it might sound like a crazy idea or maybe a boring concept to a lot of people, but to be honest with you, it's not going to be boring when you lose your job or when you can't afford to keep your employees. This is a challenge that we're all going to face. And so what we've set out to do is help companies help their employees without it hurting their bottom line. We want to make it more efficient for them. That's the real idea. So we bring technology together along with some really tax efficient plans in order to make that happen. And their employees are happier on top of that. And so it's kind of a win-win. And so that's kind of the idea. That's the premise of it.
I would imagine that anybody that owns a business that is listening to this, they're starting to tune out. And I say that because the moment they hear terminology like, well, I mean, it's a win-win and everybody's going to benefit. And yeah, we're talking about saving this and saving. And then they're like, oh, that just sounds like an actual sales pitch because somewhere in this, there's a catch. Like where's the catch? So how did you find essentially the benefits and the tax benefits and advantages to organizations and then build a model around it to support organizations to be able to offer additional benefits? So I think before you answer the question, the real interest I have in this is that I love to share information that can support the everyday person, where if you're inside of an organization, you don't own the company, you're not running the company, you're the guy that's making the needle move inside of the business, you're offering such phenomenal benefits to them that increases the actual benefits that they have through their company. And you're giving companies an opportunity to extend additional benefits where they typically wouldn't, because that would be cutting into profits. And you've somehow seemed to figure out how to do both without there being a catch.
Well, there's no such thing as a free lunch. You're absolutely right about that, Rudy. Part of it has to do with how we're going to develop, and this is something that's going to be an ongoing challenge for the next for the foreseeable future. Companies are beginning to develop better, more efficient ways to be able to provide healthcare. So think in terms of telehealth. That's a pretty common idea, but how can you provide that telehealth in a better and more efficient way? Telehealth actually can be somewhat expensive still, but there are ways through designs such as a per employee per month payment instead of traditionally having to pay it through your insurance and then having a copay, where everybody kind of shares in the overall cost, and then we take away the need for a copay for that employee. So part of it is improving the way that some of those things are done, and then utilizing technology to make that happen faster, better, more efficient. Also engaging the employees more into programs which don't affect their major medical. That's the other piece of this. How do you engage an employee to improve their health? How do you get them to start using tools that are available that don't affect their major medical? Because part of the issue is that major medical costs keep rising for employers. So we want to get employees utilizing medical programs that are outside of that traditional their traditional health insurance. Although we don't actually, in our company, we don't even touch your health insurance. In fact, you have to have health insurance coverage for your employees to utilize our program. But what we want to do is reduce some of that utilization, and so therefore we reduce some of the cost in that way. The other way is, as I mentioned earlier, being tax efficient. Now, describing to you exactly how that works on a podcast, everybody's eyes would glaze over for that, Rudy. But what I can say is that there are some laws that were introduced during the Affordable Care Act, and then there are laws going back all the way into the 70s and even the 50s that have been in place for a long time, that allow for a reimbursement to the employee, which effectively you create a what we call a self-insured medical reimbursement program. There's also a cafeteria plan involved, and there's a whole lot of other codes involved in this. Again, I'm not going to go into it, but what it essentially does is it creates an opportunity for employees who properly utilize the program, because they have to be utilizing it and getting the value out of it. That's a key point. This is not just a wave a magic wand and everybody gets to save money type thing. You really do have to have utilization, and it has to be structured properly. We have some really key structure around utilization that I don't think most people have really thought about yet, and I think it's going to become much more prevalent. But what it does is it encourages the employee to utilize it and show true benefit, and so there's a tax incentive behind doing that. And so employees end up generally saving around $400 to $550 a year per employee utilizing our program. That's net. That's net. That's after everything is said and done. They net around $400 to $550 a year per employee. And employees, their paycheck, what they take home, doesn't change. Again, it's important that they utilize the program, though. So it's not a free lunch. There's definitely requirements, but in that you're improving your employees' lives. They've got better benefits, and you're making sure you can keep those employees employed.
That's incredible. So for every employee, they're going to get $400 to $500 back. Obviously, they're paying, but they're still netting out substantially more, and the employee gets all these benefits. What comes up for me is, immediately I'm curious, what would you say is the number one objection that you guys come up against when you're sitting in front of an organization that has, say, 100 employees, and for them, they want the benefit, but they're resistant to move forward? What would that be?
Well, after they've had their CPA and their attorneys review our program, generally speaking, they get a green light. The biggest challenge is actually with the human resources department. As much as human resources wants to improve their employees' lives, they have a really tough job. They're oftentimes overworked. It's a difficult position to be in, and I think any person in human resources, I can totally understand where they're coming from, because you have employees asking questions all day long about their benefits, but on top of that, they've got to make sure that they manage what they currently have, and they're thinking, do I have the capacity to be able to bring on another program, right? And so what we have done through our technology is help answer that question. The hardest part is the onboarding and offboarding. Our program is really simple to implement, but what most people are afraid of is the onboarding and offboarding. And so we built our technology to make that really seamless and straightforward. So it's a click of a button to onboard, enter the information, and offboard is just as simple. And in fact, one of the keys to our technology is our ability to integrate with their payroll system. So we can even make it so that potentially they don't even have to utilize our system directly. They can just utilize their own, and we connect through API, if you're familiar with that terminology, to be able to pull the information, and we can make it seamless, really. It depends on the company, what systems that they have, but we really do try to keep that as simple as possible for HR, and make their lives actually better. That's the whole idea, right? We don't want to just make this another job. We want it to make their lives better too.
Hey, it's Riekstins here, and I want to ask you, have you ever wondered if there's more to your life and work than what you're doing right now? What if I told you that the universe is hiring and you were born to fill a role that will bring you true purpose and success? In my new #1 best-selling book, The Universe is Hiring, Discover the Role You Were Born to Fill, I'm going to show you exactly how to step into that role. This isn't just a book full of inspiration. It's a roadmap to help you start shifting into a more fulfilling life right now. You'll get clear on your unique purpose, learn how to align with your strengths, and take actionable steps towards the career and life that truly light you up. If you're ready to make a change and start living the life you were meant for, grab your copy today. Available anywhere you buy your books online or click the link in the show notes.
You know, you and I were talking before we hit record, and you had shared with me, which I would love to bring up now for the benefit of the audience, that you actually found the system that you essentially built with Biz 360 when you were bringing aspects of this into one of your companies. And I love that. That's really what made me want to dive into this conversation, was that I believe that in life, we're always being served and prepared for the person that we get to become. And so the situation is being served to you. You have an experience, you learn, you grow, call it a heartbreak, call it a business failure, call it a whatever, that people have these experiences. And then at the end of that, they get to turn around, teach it, and share it. When I work with people in organizations, I love to ask, how did you get here? Why did you start this business? What was the passion behind this? Where did you get there? Because we're always having that pre-qualification. And so as somebody listens to this conversation today, maybe they don't own a business and they still sticking around and listening. Maybe somebody's curious and they want to know about the tax credit more. I really want to get into a little more about you as the person and what really brought you here, because at the core of this, you're wanting to create greater impact for the individuals. You have some organizations that have 30,000 employees that are utilizing your services, and you're impacting that one person in that 30,000, individually and then collectively. And then, yeah, of course, the company gets a tax credit. But the benefit is really for the people. And you found this firsthand by having someone come into your business. You then since sold, I believe, that business. And then you created this and really now are creating great impact, which is driven into the people. What was that experience like of being in a completely different field, doing something else, seeing this opportunity of how it could create impact? And what really gave you the confidence to shift so much so into this? Because before we hit record, you said to me, Rudi, I'm so excited about this because this is the future. This is cutting edge. And I could see the passion coming through you for the impact for the individual. But I love that tipping point of where you were like, man, I need to stop doing this so I can do that, so I can create that impact. What was that like?
Well, the other company that you're referring to, we were actually working with another different tax credit that was sunsetting, and so we knew that we were going to be making a transition, that we weren't going to keep that current business running because it was specifically built for only helping to facilitate companies getting that tax credit. And so we were looking for the next phase. But during that time, we brought this program into our business. I happened to meet another associate, a business friend of mine that he introduced me to the concept. And while we were running that company, I said, yeah, let's try it out. Let's see what that's all about. And so we brought this into our company. But what I we were able to experience through that was, we experienced immediate savings. I was like, well, this is legitimate. We got the savings month one. And then the other part of it was the benefits that we brought to our employees. And they all appreciated. And so I was kind of like, this is a really cool idea. But at first, it wasn't something that I was really looking to implement in my new company. I knew I was going to be starting another company that was where InPowered 360 came in. But I didn't plan on starting with the tax credit. In fact, one of the other pieces of the company that I was previously with that I had been able to implement, I've been working with a company called Optimum for our technology. And so what we were planning on doing with InPowered 360 was really pushing more on the technology side of things through a no-code, low-code platform. It's an ERP. And so when I kind of took a look at this again, I said, you know what? And I talked to my business partners and I said, this is actually something I think we can make go and we can improve with the technology. So we're going to go and we're going to bring Optimum to the table. And then we're also going to bring this amazing program with tax benefits and wellness into the market. And so we decided, let's tie these two together and make something that's really not out there available. Let's innovate. Let's make this something new. And I think one of the things, you asked me earlier, I'm going to come back to this. What is the other big challenge? Well, we're a younger company with a program that's kind of unfamiliar to a lot of people. But what I would say to that is that right now, the current status of healthcare is not going to continue. As I said before, we're not going to be able to continue down that road. So innovation is required. I think our youth is our strength. In fact, I think you're going to find a lot more smaller, newer companies starting to burst onto the scene because they're going to find a better way to do healthcare. And that's what we're involved in. That's where we're at. And that's why, so I'm passionate about it. I believe in what we're doing to my core. I believe we're going to see this explode. And we're coming to that tipping point that more companies are starting to not only hear about it, but really actually pursue this. And so your early adopters, they're starting to get in. And I think that the early adopters are going to get the most benefit, right? Because they're going to have this for the longest period of time. They're going to start seeing the savings. They're going to become stronger, faster, right? But once we get to that 15% market penetration point, Simon Sinek talks about, but that's where we're going to begin to see, that bell curve. Everybody's going to start to join in, but the early adopters are going to see the most benefit. And so I'm really excited about working with people who are looking for a way right now that they can begin affecting their company and helping their employees. Those are the companies that are going to remain strong because healthcare has such an impact. It's the second highest expense line item after payroll. So it's pretty important.
I mean, when you phrase it that way, it really does bring to mind a few questions based on everything that you just shared. I'm always listening to somebody when I'm interviewing thinking, how's the audience listening to this and what questions do they have right now? And you mentioned a couple things. So first point I want to touch on is that I was hospitalized a little over a year ago, about 14 months ago. And I was in hospital for 3 days and they sent me a $100,000 bill. And my insurance company paid $2,000 off that bill. They found every different reason for why they didn't have to pay for something. And it was covering 14 cents here, $12 there. And when you added it all up together, they covered $2,000 out of an almost $100,000 tax bill. So I know how broken the system is here in North America. But you said something that I want to poke at for a moment. And you said these different tax credits and bills and advantages have been around for some of them 70 years, some 50 years, some recent. But what you're doing is new. So if this is new and we haven't even got to that tipping point yet, why doesn't everybody know about this and why isn't everybody doing it?
Well, there's always an adoption rate for something. Like I said, the Affordable Care Act introduced some language that allowed for a different way of being able to reimburse employees. And so there were some things that needed to be in place. Now, the program itself that we're doing has been around for about 6 years. The concept of it has been around for about 6 years. And it's really ingenious, but it's really nothing really that new. And in some ways, there are other programs that have been around for quite some time that utilize some of the same tax codes. But the Affordable Care Act kind of introduced a different way of being able to do things. So once that happened and you had some people really take a look at the tax codes, they said, well, this is a viable solution right here. And so we got a hold of it. Like I said, I got a hold of this concept about three and a half years ago. And then we introduced it, and we're like I said, we're about a 2-year-old company, not quite 2 years old. So, but we came in to scale it. So we're at the very forefront, really. That's why people have not heard about it. The concept just wasn't even available to most people. So why aren't they doing it? Most people just don't know. And now that there are more and more people learning about it, and more people are having, their CPA review, their attorneys review, and they're giving the thumbs up. They're telling their friends, they're telling the other businesses that they know about it. And so there's becoming more and more acceptance, but you've got to hit that tipping point before something really becomes widely accepted.
Where do you see this heading? And when I say this, I just mean more, not just your organization and your impact, but just the medical industry, because obviously it is a very, very flawed system. I mean, the number you gave us a moment ago, 3% is the average for a hospital. I mean, like, that's why they're charging $100,000 for 3 days of somebody being admitted into hospital. I mean, which is just asinine. How can it sustain at that level? And what do you really see if you were to make a projection for what it's going to look like for the US market specifically when we start talking about the changes that are coming with these newer companies coming up and the benefits? And
that's the big question right now. There are conferences going on all over the country right now, in regard to how do we reduce the costs on medical? How do we reduce medical costs? How do we make it more efficient? What are we going to do to not just mitigate, but hopefully improve the situation, right? And so, where I see it right now, the data that I've looked at is that through 2028, there's no change to hospitals. They're likely to remain in that 2 to 3% margin, and so that's very challenging. But you do have innovations such as AI, which can definitely improve and help. People are figuring out new ways. I also think aggregating services into more of a what can people do from home instead of going into the hospital? How expensive is it to go into the hospital, right? It's, you've got to keep the lights on. You've got doctors and nurses and staff that you've got to employ. And I want to see that continue, but how can we reduce the burden on them? So a lot of it is going to come down to what can people do to improve their health today instead of ending up in the hospital or instead of developing diseases. How can we move away from the trends that we're seeing where obesity is still a major problem, continues to get worse. Chronic disease is out of control in this country. And so what can we do to improve our health, first of all? Secondly, what can we do where we don't actually have to be in a building? We can be at home in order to reduce the overall costs. And there's definitely opportunity for cost savings. And then what can we automate that makes all of that much easier and brings it all into one place where people aren't having to go here, and all different places. And kind of the cost can be spread across more services. And, that way the companies can continue to run. The ones that are behind it need to make money to continue to run, but also there's less expense on the individual that's utilizing that service. So it's a combination of things, improving health, improving services. Utilization of AI is definitely going to be a part of this. And then I think the combination of various services and bringing them all together to make it simple is going to help tremendously over the next few years. I think that's where we're going to see it go.
You said to me off camera that your business 100% is the cutting edge of where we're going. So I'm super curious, based on what you just said, what is it that you're currently offering that are some of those solutions? You spoke about we need to somehow improve our quality of life and health before we have to go to the hospital. We have to utilize AI. We have to have these services where we can spread. Like, what solution are you currently offering that is cutting edge that other people are not offering?
Well, I'll give you a good example. Telehealth is a big piece in all of this. And how you do telehealth is important. We have a telehealth service that it's 24/7, 365 days a year, and there's no copay for the employee. You don't have to pay anything by utilizing the service. I've had employees with stories of saving, anywhere from $600 to $1,000 in 1 month, because they didn't have to go to the hospital or go see their doctor like they normally would. And that greatly reduces, of course, the out-of-pocket expense for the employee, but also by utilizing that service, it's not hitting the major medical. So the employer's going to be saving in the long run because the employee is utilizing that service instead. And it's a much lower cost service than going to a hospital. So in general, so that's one of those services. The other things, mental health is a big key. I know that a lot of what I think you're focused on is how we can improve our lives and how we think, right? But the challenge is a lot of people aren't really engaging there. And so how do we get employees, how do we get the general public to engage in their own mental health? Well, we offer services that make it easy. And so that's one of the things that we do offer in our services as well. You also mentioned, ending up in the hospital. And one of the things that we also offer with our program is there's a insurance aspect to this as well, accident, and we have life insurance and various different insurances. And we actually had an individual not too long ago that ended up in the hospital, no idea how they were going to pay their bills. But because they had a policy in place through our program that would help cover their expenses, they got about a $28,000 check to help cover their hospital expenses while they were out. And so it's those sort of things that most people, they're typically, if you're going to get a policy to cover you, if you're out of work or something like that, it's a buying decision for the employee. That a lot of times they say, well, you know what? I can either choose to pay for this insurance policy out of pocket through my employer, and maybe not be able to pay the light bill. I have one choice. I have to choose one of those things, I guess is what I'm trying to say. Where what we do is, because the way the program works, there's an amount left over that they can choose a certain type of insurance policy. And then it doesn't reduce their take-home pay. So there's really not a buying decision there, because the take-home pay remains the same. And so now they end up with this additional insurance coverage that they wouldn't have had.
I keep listening to this thinking that makes all the sense in the world. That makes all the sense in the world. That makes all the sense in the world. But I would imagine for so many people that's a big hurdle to overcome, not knowing how much commitment or work or what the potential cost or the shortfall could be in that. And so I would love to encourage somebody that has a business, that has employees, that has the potential to offer that, because I'm going to tell you now, I had an insurance policy that I didn't know existed, that somebody had pointed out to me on my team and said, hey, you can execute this. And it covered 100% of my medical bills. I had like a $5,000 deductible. But without that, a $100,000 hospital bill is debilitating for anyone at almost any income level. That is a lot of money. And I remember for days thinking, oh my gosh, I'm liable for $96,000. Like that was my responsibility. And I was like that's going to hurt. Like, how do you figure that out? And you think about how many people don't even pay their medical bills. And of course, we have these ongoing problems. So when I hear things like that, I'm immediately passionate thinking about the individual inside that 30,000 person company, because the leaders of the organization so let me clarify here. Any company is going to get a tax credit of $400 to $500, you said, per employee, which alone would make any business leader say, oh, we should look into that. But where I come from is more the benefit to that guy that's going to get hit with that bill, that's going to have some level of support, or that's going to have preventative work. And so that's really where I am the champion of what you're doing, and why I said this would be great to bring onto the platform, because I've seen the benefit of how you've supported people that I'm aware of in business, and then also what has been my experience not having this. So my question to you really is, for the person that's listening to this, like, how do they know they're ready to reach out to you? Like, who do you serve?
Well, we can help generally any company with 10 or more W-2 employees. There are a few stipulations. They need to be working full time. Now, we classify that as at least 25 hours a week. Generally, in order to be able to qualify, they can't be on any Medicare or Medicaid. Unfortunately, just because that's a federally funded program, and so they wouldn't qualify for this program the way that it works. But for the vast majority of companies, this program is truly ideal. It's it's now I say ideal, of course. There are some companies that might take a look at this and say, well, we already have something else in place. I would say before you jump in head first, we have a conversation. We take a look at what you're doing. Maybe what you're doing, wouldn't work with what we're doing, but a lot of times potentially it does. We typically do not have to change anything about what a company is currently doing with their healthcare. And in fact, if you already even have supplemental benefits for your employees, we don't change that either. Sometimes we can even help make that better. And we can improve it and even save the employees even more money. So there's a lot of things that I think people would be hesitant about that they just don't understand until I would say get on a call with us. We do like a 20-minute call just to help evaluate. We let you take a look at what the program does, ask questions, and we kind of move on from there. We can get a proposal put together if you want to move forward with it. But it's really just an opportunity to take a look at the program. And really, we even go into exactly what it looks like on an employee's paycheck. And so most companies are right to wonder and ask the question. I think it's smart to say, well, how can this possibly work? I mean, it sounds too good to be true. That may be one of those objections too that we get often, but it does. It may sound too good to be true, but I will say that there's no such thing as a free lunch. There are requirements, but they're doable requirements, and they're good for your company and they're good for your employees. So you should take it, at least give us the opportunity to show you what it's all about.
Well, I absolutely love what you're doing. I love the benefits that you have. I mean, anybody that's listening to this is 100% going to hear the benefit from the employee side and the benefit from the employer side. Because obviously, anyone that's going to be able to save money, they're going to have additional benefits to offer their teams. Just sounds absolutely incredible. So I want to thank you, obviously, for your time. I want to challenge our audience. If you have a business or you're curious, you want to offer additional benefits to your teams. I know the value of when you pour into your people, how your people feel committed to you and to your business. And this is one of the greatest ways that you can create an impact in somebody's life, because as an employee, you are going to be more committed to somebody when you feel like they actually care about you. And so 20 minutes of your time, have somebody get on the phone. I love that you mentioned, Tim, that it's usually human resources that are the people that are the stick in the mud because they don't want to take on the additional work. And obviously you had said that you absorb a tremendous amount of that, and it would be worth the 20 minutes of their time and the potential of creating this level of impact. I want to thank you, obviously, for joining us on the InPowered Life podcast. I love to find people who are creating great impact out in the world. And so often we think that creating impact is when you've written a book, or when you are speaking on a stage, or when you've overcome a debilitating disease and you've healed and you now tell people about what you've done. Sometimes it's people that are doing great things like what you're doing and Biz 360, where you're offering every single person out there the potential to have a better overall quality of life. I know that off camera we had spoken about the health crisis and the ability for people to have call centers to call into and all these things that we normally just don't have access to, and making it so accessible that somebody that is in a difficult spot can get the help that they need. And that's really what my gain and benefit in bringing this to the InPowered Life podcast and the benefit for everybody. I would love to know if there was one closing message that you could share with anybody that could maybe be an encouraging statement, a nudge or a push for them to schedule a call with you, which obviously for the benefit of the audience, I'm going to put all of Biz 360's information in the show notes. There'll be a link for you to schedule a call if that's what you wanted to do. So don't worry about telling us how to find you. We'll add that in for you. But what would be one parting message you would want to share with somebody that's sitting on the fence?
Well, Rudi, one experience that we had early on was there was an employer who had lost one of their employees during work. They died in an accident, and the employer didn't offer insurance benefits to the employees. They just weren't in a position to do it. And so they unfortunately, the family had no life insurance, no way of being able to take care of their family. And so The employer decided, I'm never going to do this again. I'm going to make sure that all of my employees have life insurance. So we were able to help get them set up with our program. Again, our program helps on the health insurance, the health benefits side, but additionally, there are some other supplemental benefits like life insurance. And so we were able to help this employer get set up with that. Unfortunately, just a few months later, another one of his employees, a young man, died again in another accident. And this time, the family had coverage. It was a big deal because previous to this, the employer could not afford to help his employees get supplemental benefits, and the employees, they weren't going to make that decision for themselves. So you're talking about a lot of young men in this business. He was able to make sure that they were all covered without reducing their take-home pay. If I'm going to talk about why somebody should look at this, it's thinking about the employee, the impact on the employee. What is it going to do for them? Of course, you as a business, the savings, fantastic. You always want to make sure that you're taking care of your company, because that you've got to stick around. You've got to keep going. But it's the impact on the employee. It's keeping all those people employed and making sure their families are taken care of. I think that's why, if I was going to say anybody should set up a meeting with us, it's to make sure that maybe there's a way we can help your employees.
Man, you just spoke into my deepest fear. I started a business years ago when I had first immigrated to the US with my brother, and we had around 30 employees, third shift employees, and we were just scraping to make every wage payment, let alone having additional benefits. And so one of my fears was always, what does it look like if something goes wrong? I mean, when you're putting everything together with glue and duct tape, it just takes one rip of the seam for everything to fall apart. And I used to lie awake at night thinking, what if somebody falls off a roof? What if what if there's an accident? What if there's a car accident? And never having that. And so when we had our first opportunity to start taking out benefits, we did. But it took so long to be able to get to a position where, I say so long, it was probably 15, maybe 18 months, but that's 18 months of a lot of risk. And, we thankfully, touch wood, we had no issues. They still today, companies running beautifully, no issues. But you never know. You just never know when you can have that happen and to not be prepared. You would have sold me right away when you said, Rudi, I can give you a $400 to $500 tax credit per employee. I would have been like 30 employees, $500 a year, I'm in. But I think about the story you just shared and how that is real for so many business leaders. And I believe that we as business leaders have a moral obligation to the people that we work with and to give them the best that we can. And when you have access to something, even at the cost of the company, it should be a non-negotiable. But when you have access to something that is not costing the company and it's yielding a tax credit and it's adding benefits, I mean, I don't know. I don't see why anybody wouldn't want to look into what you're doing. Tim, I want to say, obviously, just a huge thank you for coming out on the show, man.
Yeah. Well, thank you, Rudi. And, never underestimate the impact that you have on people's lives. As an employer, you are their lifeline. They are depending on you in some ways, maybe more than you're depending on them. And I don't think that we as employers always recognize the impact that we're having on these people's lives. But I can tell you that, when I look around the room at the employees that I have, and I think about some of the things that they've told me in confidence, just about what they view their life as and the excitement they have because of the work that they get to do with us and the fact that it's providing a way of life, you realize, you are playing a huge role. Healthcare is a big part of that. So, Rudi, I really appreciate the opportunity to come on with you today.
Well, I always believe that everything happens the way that it's meant to happen, divinely orchestrated in every moment, and connecting with you obviously has been another one of those. I hope that somebody listening to this today takes action, whether it's through you or in any other way that they can offer their employees more benefits, that can support them, that we can prepare for the inevitabilities of what happens in life, so that everybody is left better than the way that they were met in the initial interaction. And I think that we 100% as employers and employees, it is an equal exchange of energy. We show up to work expecting a paycheck, and if nobody shows up to work, there isn't a business. And so it 100% is that equal exchange. And yes, we're paying, and yes, there's services, and yes, there's things that we're legally obligated to, but we must never, ever, ever at the core forget that we're human beings and that we have a responsibility up and down that ladder. And this is just a beautiful reminder to us all that we get to create that impact. To you, the audience, I just want to thank you for investing yourself, your time into today's conversation. I hope that if we have piqued your curiosity, you're going to look at what are some of the comp plans that you're offering and the opportunities that are available to you. And obviously, if you're interested, exploring what Biz 360 has to offer. But from my heart to yours, I want to thank you for spending a little bit of time with the InPowered Life Podcast. Go out, be bold, be brave, be beautiful. And I'll catch you in the next episode of the InPowered Life Podcast.
If you enjoyed this episode, please subscribe so you don't miss out on future content. And we would love your support in leaving us a review wherever you listen to your podcasts. Make sure to check the show notes for more information on how you can find us online and on Instagram. Now go create an amazing day for yourself, and we'll see you again soon.